Volar approach to the distal radius, internervous plane between the brachioradialis and pronator teres, distally between the brachioradialis and FCR. So proximally, Henry approaches between the brachioradialis, which is supplied by radial nerve, and pronator teres, which is medial nerve, and distally it is between brachioradialis, which is supplied by the radial nerve, and the FCR, which is supplied by median nerve. Incision from the bicep tendon to the radial styloid on the ulnar side of brachioradialis. Identify and protect lateral cutaneous nerve of the forearm when it exits beneath the lateral border of the bicep tendon, superficial radial nerve and radial artery beneath the brachioradialis. Supinate the forearm to displace pin radially. When you're incising supinator, it should be along the medial edge. Ligate recurrent leash of radial vessels, which can bleed. Pronate to detach pronator teres insertion of the midshaft of the radius. Release flexor pollicis longus from the radial side as AIN supply from the medial side. So the important thing is supinator should be released from medial to lateral, pronator quadratus from lateral to medial, and flexor pollicis longus again lateral to medial to avoid AIN injury.